Hi, everyone. I'm so excited to be here. I hope folks are here and you guys are joining me. I'm really excited for today's session. Good afternoon. Of all the places you could be this afternoon, you're choosing to be here, and I am determined to make that worth your while today. Um, so thank you so much for being here. Um, just some housekeeping stuff. If you are joining me live right now and you can hear me really, really well, a simple "we can hear you" in the comment box would be greatly appreciated. I'm going to just give it a couple of minutes to see if we can get as many people as possible that are able to join us in real time today to be here. And to also make sure that my comment section is working. So, because I definitely, hi everybody. Thank you so much for the sound check and confirmation that you can in fact hear me. I'm really excited to be here. Um, this is part, or this live event is all part of my continuous efforts of trying to find more creative ways to be of assistance and help to pharmacy candidates that are pursuing residencies and have limited resources, limited time, feel like they're kind of just spinning their wheels when it comes to residency match readiness in general, and to see if I can be of assistance in helping improve my reach and helping improve my assistance with all of the time and energy and years that I have had the privilege of being able to host, participate, speak, and assist countless candidates at this point secure a match at phase one. This is one of 5 series that I have organized and orchestrated and hope to carry out between now and the peak of interview season by February or by mid-February. Um, this session is called "To Ace Your Pharmacy Residency Interview Questions in 2021." My objective with this workshop is to really just help provide answers and help provide clarity around the interview process and the format or the various formats for that reason that you could potentially encounter as you embark on this journey and begin the process of interviewing. So with that, I think we will start. It's 2:04. If you also join my workshops, they're interactive. They go as long as the questions come in, but my goal is to go straight to the point. If it's your first time being here, especially on the YouTube channel with me, I am the founder of ResiPrep 360 and also a founder of another tech company, as well as co-host of a podcast. Hey, RX friends, we got this podcast, which is just myself and another pharmacist who is also a millennial like myself. We get together and share our stories, both personal journey, professional development stories, life journeys. But we're really just two women that are entrepreneurs and also pharmacists, and sharing our stories and hoping that that empowers others like you to go after what you want. I am a residency match expert. Resi Prep has been a program that I have executively kind of run now for over 7 years, with a match rate every year consistently of phase one that is above 95%. Our 2024 match rate was around 96%. My commitment to candidates that I work with is to get you out of the match at phase one. So all of the guidance and mentorship and assistance that I provide is based on that success that I have had working with candidates and being alongside them as their advisors through phase one and being able to successfully do that. I need your help with growing this movement. Where you are right now, if you could just like this video and subscribe to this channel if you haven't already done so, it's going to go a really long way in helping make this channel discoverable for the countless candidates that are out there looking for help and looking for assistance and trying to get a residency position, as that could be an incredibly lonely journey and isolating even for some people. I wanted to kick today off with a good understanding of those of you that are here with me right now in real time about why you are here. Um, those of you that are present right now that I have worked with in the past, you know that I am very driven and focused on what your needs are and providing personalized assistance. And so I would really love to know in the comments, like, what brought you here? Are you anxious? Are you feeling overwhelmed? Are you just here to discover and learn? Any one word, one sentence, anything that you can drop in the comments to get us started so that I have you in mind as I present. If you are a new practitioner who's here, or maybe you are someone who's interviewing still for fellowship, why are you here? And so that as I go through today's workshop and this presentation, I can keep in mind that I am meeting all of these individual needs as much as I can. Lauren, thank you for jumping in first. I'm here to get insight on how to answer interview questions effectively. I can help you with that today. We are going to talk about answer structure, how to link the examples that you decide to pick, how to select the correct examples so that you are answering the question. Like, you're not just going in circles around what you think the question is, but you're going after the question at the heart of it. And I'll teach you to kind of recognize and separate the question that is being asked from what they are implying by the question. Hillary, I'm here to seek for guidance going into residency interview. I've got you. April, very nervous and scared for interviews. I want to know how to impress my interviewers. You will, April. We will work on that. Residency interview prep, Peaches in general. Sarah, I want to feel confident in my answers in the interview. What you all are sharing with me in the comment right now, I'm very happy. I came prepared for y'all. So that's making me very happy that I came prepared for you guys. But I want to start a little bit on the confidence thing. And I'm gonna get in my soapbox a little bit, but confidence, we all seem to feel like it's this thing that's going to come from all of the external things that we've accomplished. We really believe that, like, if I stand in the shadow of my ROCI recognition, my elected positions, my dean's list designation, if I stand in the shadow of all of this hard work and dedication and commitment and proof of those things, I am going to feel confident. As a candidate that had several of those things actually made me super insecure and really, really scared because I just kept feeling like at any moment they could call me out to prove that I was the dean's list student. So I must know the answer to everything that comes up on the clinical challenge. Because I had all these elected positions, if a leadership question came up, I had this intense, immense pressure to feel like I had to over deliver on those things. What I learned over the years about how confidence is built, it's actually built through self assurance. If this is a new concept for you, self assurance simply just means, like, what do you believe about yourself to be true? What is that thing? I want you to really critically think about that, because that's where the confidence that you need to go in and impress, that's what it's going to come from. For me, I really just know that I am a heck of a resilient person. I know that I have work ethic that is unmatched. And I know that I am a quick study. I'm coachable. I ask lots of questions. My intellectual curiosity can at times be obnoxious, right? Those were my self-assured qualities, and I stood in that. And so when interview questions come about, when I meet people, when I feel a little unshaky or I feel like I'm uncertain about the direction that this interview is going in, I remember those qualities about myself. I know that I work hard. I know that I can get pushed to great limits and still be able to stand up to a lot of challenges and come out on the other side of it. Even if on the surface it looks like I've lost, I was paying attention through that challenge to make sure that I learned something about myself. I want to really encourage you to think about the source of your confidence as being that. If you objectively look at all of what you've accomplished, you've done some amazing things. Stand in those things and stand in that power. And no matter how that interview is going, don't allow any of those experiences to come after what you already know to be true about yourself. That's it. That's it. That's my little soapbox for today. I'm done with it. Um, the types of interviews, I always start here because sometimes I find that many people don't even know why the interview is necessary. So if we started there and we started with critically evaluating why do they want an interview? What is the purpose of the interview? The reason why you are being interviewed, number one, is because the program feels like there is a certain level of alignment with what you are as a candidate, an individual, a person, what you've done, but also even what you're missing. They are feeling already on the surface that there is something that they have that they can offer you based on some things that they see in you as a potential. Interview offers, whether it's a phone interview, it's a virtual interview, it's a first round, it deserves celebration. And I hope you're taking a beat to celebrate your interview invites because it's a trigger to tell you, like, hey, there's an alignment here. There's something that they're seeing that they like. Your job on the interview now is to come and accentuate all of the things that you already know you can do, the things that you've learned about them that they have that are perfect for what you are hoping to accomplish for your career, for your life, for the people that you're looking to help, your patients, the impact you're looking to have. Traditional interviews are usually either one-on-one or panel discussions. I personally prefer one-on-one panel discussions. I get really nervous in those. It takes me a little bit to get my bearings around that because one of the most powerful things in in-person interviewing is that human connection, and that usually happens through reflective listening, giving people eye contact as they're talking, your body language, you nod, you acknowledge the things that they say, you go, ah, yes, oh, I know, right? Some of those are easier when it's just you and one other person. But when you're sitting down in a chair and you're facing three, four, five people, you have to learn to balance how you distribute that that emotional intelligence of reflective listening, and that tends to make me a little nervous. So I always give, like, if you find out that if you find yourself in a panel interview style, pick, if there's six people in the room, pick three people that you're going to make your focal people, and make sure that more than 80% of your eye contact is with those people. But don't feel overly pressured that every single person on that panel has got to receive the same level of eye contact that you're giving everybody. You're going to get overly anxious and overwhelmed, and then you're going to leave feeling like there was one person, I didn't look at them not one time. Well, that's not possible because each of those people in that panel, they're going to ask you a question. And usually, when you kick off your response, the person who verbalized the question should be looked at in the eye and all as you kick off your responses, and then you can distribute your eye contact across the room. These interviews really heavily your personality, your experience, your communication style, and your delivery style, dictation, enunciation. These are going to be where, like, your bonus and brownie points are going to come from, in addition to the quality of the responses that you deliver. I may not have said this already. At any juncture, if you want to stop me and drop a question in the comment, please do that. I'm monitoring that very closely. I will pause and elaborate on anything that's unclear. Virtual interviews are becoming the new rock stars and the new norms thanks to COVID, right? In 2020, I had to learn deeply about virtual interviews because everybody was virtually interviewed, and I knew very little about the space and the technology and the unwritten rules around virtual interviewing, right? Fast forward now to a few years, there are some things we know that for virtual interviews, when they come onto the Zoom, they should find you in the chair waiting for them. That is the indication of being on time. You should not log in and find them there. Now, if you log in 5 minutes before the meeting and they're already on, that's okay. But I always recommend that you log in at least 15 minutes before. Typical, similar to what you would want for in-person interview, arriving 15 to 30 minutes before. If you arrive an hour before your interview, that could be a little too much. You could be rushing them to get ready. But 30 minutes before your interview, you can have a seat, drink some water, take in the scene. All of that is good. For virtual interviews, I strongly recommend that when they log on, they should find you seated, ready to go. 15 minutes before that is always good. Lighting is going to be your best friend. Invest in it. If there's a room that you're going to interview in and they don't have a window, please take your laptop or the computer in that room and test it ahead of time to make sure that lighting is good. Lighting does not have to be like perfect, but you shouldn't be a shadow figure on the screen, right? You should be visible, clearly seen. They should be able to see you about from here up. Like you should be within frame with a little bit of space on top. What we don't want for virtual interviews is for you to be like this, like like this. I was trying to like replicate that as much as possible. Like we don't want to be like up on the screen. And so safe distance away from the camera where you're about right here, like a passport style picture is another way that I saw someone describe. I was like, that's kind of really good, right? But to be in frame. Eliminating distractions. If you're sitting somewhere where people are going to be walking past, it's human nature. You may look up. You may look up and kind of see things moving around you, and that could be very distracting. Even when I do mock interviews, I will tune people in and I'll ask them, "Are you reading?" And they're like, "No, it's because you're down here on my screen." Your eyes can wander, and you don't want that. You want your eyes to be fixed on and giving that illusion of eye contact. So there are all these little weird little things and nonverbal cues that happen with virtual interviews that I think makes them a lot more challenging because your interviewer doesn't get that energy of in person off of you. And so they do deserve the right amount of prep and testing, investing in a microphone if you must. And if not, before you kick off your virtual, it's always good to do a mic check. Can you hear me okay? And wait for a confirmative on that, and then you can take off, because it's just awful to get interrupted. It's like, oh, we can't hear what you're saying. Then you have to start your whole spiel all over again. I wanted to include this in here. Like I tried to figure out a creative way to do this, and this is the best I could do. What you're looking at here on the in the triangle figure, this is usually what your Zoom or your virtual meetings look like when you put it in full screen. Both you and the guest will appear side by side in a horizontal way. The problem with that is, as you're talking, your eyes are going to go to where the guest is, and that's going to make you look like you're looking off to the side. The person receiving you on the other end receives you on the other end as if you're looking off to the side. What you want is this right here, this vertical setup. You want to minimize your screen so that you and the interviewer are superimposed on the screen. And then you want to move this and put it right under your camera on your laptop or on your computer. What this does, it guarantees that you are giving straight eye contact and that the interviewer is receiving you as given eye contact the entire time you're interviewing. But any other view, it's difficult to tell. Like if the interviewer is on your left or your right, your eyes will go to them on the screen. when in actuality, they're just kind of wondering, they may think that maybe you're reading a script or something else like that. And you don't want to create that illusion for your interview. And then there are MMIs, right? Like MMIs for me are my favorite because like I'm not stuck in any uncomfortable, awkward encounter for too long. And then if the encounter is going phenomenal, we both leave feeling like we wanted more, which is what you want in an interview. You want to leave the interviewer feeling like, oh my gosh, like there's so much I want to learn about you. Like we've run out of our 30 minutes already together. That is an excellent sign. When you walk away and the interviewer is just like, ah, we got to talking about plants and I have all these questions I wanted to ask you and I never got to them. It means that you've won at the interview game because you've been able to pocket this interviewer by having a genuine human connection, and that transcends any of these technical or practical questions that they have. MMIs are usually 30 minutes in length for residency interviews. They'll usually be with preceptors. Sometimes your MMI could be with a physician that collaborates very closely with the pharmacy department. They may send candidates there to engage with that physician to see if that provider may be able to provide any insight about fitness and things like that with with the candidate. But it's why, like, and we'll get into tell me about yourself in a bit. It's why, like, sharing things about your life journey, things that are not pharmacy related, could be really powerful tools of building personal connections as you interview. Presently, there is ASHP has no requirement about the distribution of interview formatting, right? In one program, if the interview is 4 hours, they could take 2 hours and give and make four different interviews, MMIs, where you have 30 minutes with four different preceptors. And then they'll take an hour to do your clinical challenge. And then they'll take another hour for you to do a 30-minute case presentation with 10, 15 minutes of questions, and then wrap up with the RPD for the rest of the day. And your interview is over. Some other interviews will be a panel for 1 hour, a presentation for an hour, a tour for 30 minutes. And there's no structure. The program will design and set this up however they want, forcing you as an incumbent to really prepare globally. You cannot spend too much time on any one particular thing because they're looking for good command and not mastery. So you have to prepare globally for the interview because you could face MMIs, you could face panels or one-on-ones, and they could do a first round that's virtual, but then you're invited on site for a series of MMIs. So you have to be ready for all of it. I think we have our first question. So April asked, will the questions be mostly clinical knowledge? So your interview logistics will usually get shared with you. And here again, there are no rules about how they do this. Some programs will tell you that there's a clinical challenge as a part of your interview process. That clinical challenge, the structure of it is totally up to the program. Some programs will give you a series of 10 questions that are completely unrelated. Like one question would ask you about a patient who's on vancomycin. What are 3 questions you have about their therapy on day 3? Another question asks you a patient who is on warfarin that needs to be transitioned to a DOAC. They won't tell you if it's Eliquis or Xarelto. What are some considerations that you have to have, or how do you do that, or where does the INR have to be before you can safely transition that patient? And another question could just be for you to calculate creatinine clearance. 10 questions, and then depending on how you do on these 10 questions, they give you a ranking or whatever that goes as a part of their rank decision. Other places will just give you a patient case. They'll actually give you a patient case and give you 30 minutes to read it and tell you to identify all of the medication related therapy problems within that case and provide, and then you'll have a discussion. That discussion may happen with residents, or that discussion may happen with residents and a preceptor. But programs, again, they have their own structure around that. There's a workshop I'm doing specifically around the clinical challenge and how to prepare for it. But it's a great question because today is about overall and an overview of interviewing. But it won't be mostly clinical. The questions are going to be mixed and balanced, but most programs today will have a clinical challenge for you and a component of your interview that has a clinical questions where they expect you to kind of demonstrate how you think critically and how you problem solve around different things, in addition to asking you just random pharmacology based questions around that. Great question. So to be able to prepare for your interview, the structure that I have found to be most effective in helping you figure out how to respond to question is by making sure that you are highlighting all of your actions and things that you've done in the past, and you're categorizing them under these three things: either results, relationship, or outcome. And what I mean by that is, for the questions that you're going to get asked, these are the most common categories. Let me see if there's a way. These are the most common categories. Take a picture of this, screenshot this, whatever you must. But for your interview, as you are preparing, these are going to be the 5 main categories that all of the interview questions that you're going to get asked, they're going to fall under these big umbrellas. So as you start preparing and figuring out what are the strengths that I'm going to talk about, what are the weaknesses that I'm going to talk about, I want you to organize the strengths and the weaknesses under relationship building, results driven, or outcomes driven, problem solving, and problem solving questions. Behavioral based question. Tell me about a time when. A lot of people hate these, but I can show you how you answer these questions in a way that makes them far less intimidating. Creative and insightful questions. So this is where they'll ask you questions like, you're stranded on a deserted island. What are 3 things that are absolutely coming with you? Or if you could be a medication, what medication would you be? But this is where like they ask you like weird, silly questions like, a plane crashes and you can't get off the island. What is the first thing you do? And these are the things that you have in a backpack. They get very creative around this, but you want to think about results, relationship, and outcome, and making sure that you're framing all of your responses within that, no matter which of these categories they're asking you questions in. And so for situational based questions, the STAR method continues to be the gold standard, right? And for the STAR method, what happens during interviews is that people get overly fixated on talking about the situation. It's either one or two things happen. They downplay the situation. So if the question is, example, tell me about a time where you had a conflict within a team that you were working on. How did you deal with that? They'll downplay the conflict. They won't get descriptive about the situation. The tip I have for you here is that the situation should be described in no more than 10 to 15 seconds. You want to be clear about what the situation was, because immediately following that, there was a task. There was something that needed to happen. You want to make sure that the interviewer has a good grasp on what that task was and what your role, especially because for each of these, you have to remember, like, you're the one interviewing, you're the one who's in the hot seat. They're interested in you. And so if the conflict was with the other person, do not spend all of your time talking about the other person and they did this and they did this and they did that. Focus on you, person first. Focus on you and the action that you took. What was your responsibility, right? Because majority of the time you allocate to responding has to go to the action component. They have to be able to clearly understand the steps you took, what you did or what you didn't do. If you escalated it, if you got the conversation mediated through a supervisor, You want them to understand that because that makes the next session the result. What was the outcome? What was the outcome? They have to be able to connect your actions with the result. And this is where our framework comes in. Was the result quantifiable, right? As a result of your action, your pamphlet was able to improve patients' intake process by saving administrative check-in at the AmCare clinic by more than 10 minutes. This pamphlet you created to help with patient discharge and patient transition, it improved communication with the primary care office, and the primary care office was able to now know the exact list of patients' medications at the point of discharge. That's relationship building. And then we talk about outcomes. As a result of your action, what was the outcome, right? You were able to influence a policy. You were able to influence a protocol that was created. Most people get confused. Well, what is the difference between result and outcome? Results is usually quantifiable outcomes. It's usually you have a number. You can say that your grade went from a C to a B. You can say that you increased membership from 30 people to 70 people. You can say that you can put numbers to the action that you took. You can put direct numbers to those things. An outcome, it's more of a system change. It's more of a global change, right? If you were able to engage the school's administration in a policy change in the assessment process, that's outcome. That is something that is going to be in place long after you've graduated and have moved on. And so think about long lasting outcome. And absolutely, there are times where the result that you're quantifying has outcomes that is also global. So I don't want you to get hung up on that. It's a difference without a distinction in most cases. Okay. The thing that I want you to please not forget here, the STAR method is wonderful, but these situational based questions, your interviewer is listening to know what you learned from this experience. If they ask you, tell me about a time you failed, and as a result of that failure, you went to tutoring, you went to see the professor, you started viewing YouTube videos. What you learned was that it's okay to ask for help. It's okay to get to look for non-traditional avenues for that help. So YouTube, it's not everybody's first instinct. Well, I don't know. I'm a millennial. It wasn't our first instinct, but I feel like Gen Z's, like it's always YouTube University first now, right? But thinking about non-conventional ways of solving problems. And if you ever took that route to solve a problem, you want the interviewer to know that, because this goes to the heart of the case of how creative, innovative, and also quick on your feet, and the fact that you don't give up, that resilience factor in solving problem. Every situational based question you're asked, please do not forget to say, and what I learned from this experience was, and how this experience left me different was, and what I took away from that experience was explicitly stated so that the interviewer can hear that, because I guarantee you that they will write it down, because it's one of the things that they're listening for. They're listening to know, as a result of each of these situational based things that you face, you moved forward with the pearl, with the gem, that if you face this situation again, you would approach it differently. You would approach it smarter because you have experience with that. So how do you deliver these? I think specificity is very important. So let me see. Let me give you an example of why being specific could be important. What would you say? What role would you say you play on a team, right? That's a situational based question. And oftentimes, the way people answer this interview question is by saying a bunch of things. Like they'll say, well, usually for me on the team, like I'm really comfortable leading, but I'm also comfortable following. So I can kind of take direction from the other team members, and they know that they can rely on me if they need support, and I pretty much support them. And then if at some point I need to take over, I'm very comfortable taking over. This is very vague. Like, this is very ineffective way. It's a very ineffective way of responding to this question, because you're a little all over the place. When they want to know, the question was, what role, singular, what role do you normally play on a team? It's important to be specific. A great way to address this is, yes, you can start with, I tend to be naturally inclined to lead, and my peers know that I'm very comfortable in leadership roles, but I have learned a lot by being a supportive team member. I really relish the opportunity to step aside and give my colleagues, my classmates, and people that I'm on team with the opportunity to experience and build on their leadership skills as well, and taking directions. I think that even as part of building my leadership role, my leadership skills, learning how to take instructions from other people is a very important leadership trait as well. So anytime I have an opportunity, I do that. For example, when I was working on a project in pharmacy school with a bunch of people, and you explain, you always want to tell a story. You do not want to give a response to a situational based question and not accompany that with a story. The reason why that is because the story helps drive the point home. Because if my point here is that I'm a natural leader, people around me know that when they say get in a group, they all usually would look to me. But the few times I've had an opportunity to step aside and let other people lead, I've enjoyed it. I've enjoyed it. And I can tell you a specific example of when I've done that. So think about picking examples that allow you to go directly to those stories and be able to tell those stories. You want to be able to always say, for example, the moment you recognize that this is a situational based question, really start thinking about what example or what story can I tell here that can help drive my point home, and saying that, yeah, I'm a natural leader, but I love taking instructions from other people and learning how to hone those skills of being directed by others as well, and doing that comfortably and supporting move a collective vision forward, not from a leadership standpoint, but from a supporting role, right? So it's focusing on one clear example and avoiding unnecessary details. So unnecessary details are things like when you start to talk about, it was a really rainy day and there were like 50 people in my class. I come from a really large class, or we were working on a group project and we were asked to divide in a group of 5, and then I ended up in a group of 7, and then that adds no value to your response. You need to go straight to, you were in a group, you usually are comfortable leading, but there's something about also being a supportive team member and taking instruction from other people because you recognize the value in that, and taking instructions as a person that's also a part of a team. Practice linking your strengths to impact. Please practice this. Please practice this, because the question about your strength isn't what are 2 major strengths you have. Interviewers have transcended that. They no longer ask this that way. They usually ask, what is a strength that you credit for all of the success you've had so far in your career? And you have to hear this question exactly for what it's asking. They're not asking you to list the strengths. They're asking you to tell them how the strength is the reason why you are in the position that you're in, right? I had a student I was working with, really smart, really, really smart. But I think like beyond just the fact that he was smart, I think it's that he was really, really disciplined and his grades were excellent, right? And the way he described that, I realized, I'm like, this is how you answer this question really, really well. Because he talked about the fact that everyone looks at his grades and think that he's just this very smart person, but he just works really, really hard. It takes him more than one time to understand things, And because of that, he knows that he has to go over things more than once. And having that discipline and that time management to really put forth the effort necessary to go from just good command to mastery is what he credits for the exceptional grades that he got in pharmacy school. He doesn't necessarily see himself as the smartest person in the room, but he knows that he's got discipline and hard work on his side. And that is how he has been able to be very successful academically over the years. And I was like, that's excellent, because for a lot of people, they think they don't really know how to connect like their strengths with their successes. They can say, I'm hardworking, I'm resilient, I'm really good at time management. But can you tell the story? Can you really describe how good time management has resulted in your ability to be president of X organization, maintain an internship at the same time without letting your grades fall behind? That is an exceptional way of linking your strengths to impact. You have to have success stories that talk about relationships, that talk about results and outcome. I'm going to harp on these three so much because the more you practice putting your examples in each of these buckets, when the interview questions come, they're going to flow. They're going to flow for you very easily. I haven't checked the chat in a minute. I'm going to pause right here for a second and look. Um, Oh, hi, Noah. Thank you. Thank you, Noah. I appreciate that. How long should each story should oh yes. Okay, sorry, Lauren. I my brain and my mouth are not on the same page. How long should each story be for these situational based question? Lauren raises an excellent question. And I'm going to explain something here. So, effective interviewing recommendation dictates that when you are asked a question during an interview, you should speak for a minimum of 1 minute. So, part of the thing I encourage you guys as you practice is to also time yourself to make sure that you are speaking at least for a minute. But you are allowed during any question to speak from 1 minute to 4 minutes. What you're going to learn is that 4 minutes is a very, very long time to speak uninterrupted. So when I do mock interview with you guys and I time you, I will usually tell you when your responses are longer than 2.5 minutes, consider trimming it down because you're probably using a lot of fillers at that point, or you're adding a lot of unnecessary details to make your responses longer than necessary. But Lauren, situational based questions, 10 to 15 minutes for the situation. The task is a clear description of what your responsibilities are. That's another 20 seconds. I want you to allocate at least 40 to 45 seconds of your time to describe your action, and another 20 to 25 seconds to the results, 10 to 15 for the lesson. If you break your responses up that way, you will speak under 3 minutes and get your point across very clearly without feeling like, oh my God, I've been going on and on and on for a very long time. You're going to feel like it's a long time because once they ask the question, they sit there quietly. And 2 minutes is a long time. Just time yourself. You guys will tell me. 2 minutes is a long time to sit and speak uninterrupted when nobody is going to cut you off. But conversationally, 2 minutes is nothing. 2 minutes is like, what? Like, that's nothing. But when you sit there and you're talking for 2 minutes by yourself, you're like, oh my God, like, this is actually a really long time, right? But no matter how succinct, no matter how straight to the point um you want to be, I encourage you to speak for at least 1 minute. Any answer that is under a minute, you want to reevaluate to see if there's anything else, content or quality that you can add to that response. Before we go to common interview questions, I want to see how many seconds should we okay, sorry. How many seconds should we focus on the action section of the STAR? So Hillary, the action section is the largest. So that's the 40 to 45-second time block. It is the biggest chunk of your response. And the reason for that is You want the result to make sense to the interviewer. And the only way that the result, the outcome is going to make sense to the interviewer is if they can clearly understand what you did in the face of that situation. So you don't want to like just speed through that or be superficial about it. Be descriptive, and giving the details necessary so that when you say, I was able to then retake that exam and score a 95. They understand it because guess what? You told them you increased your library time from 1 hour to 3. You went to the tutoring center instead of once a week, you went 3 times a week. You started taking office hours with the professor to improve. You looked online for question banks. You described all of the things you did, and the result clicks. And then you can talk about the lesson learned. Um, and then I have, could we still book with you for mock interview? I have to look. I believe, yes, I have some time, but I have to be very honest in that priority is going to all of my co-resis that have signed up. I believe they're all on the books for a minimum of 2 interviews. That's my commitment to everyone, that I will mock with them at least 2 interviews. And so this week, I will definitely announce something public and put the link out there. Send me an email so I can add you to a wait list, okay? Send me an email. Common interview questions. Here, I wanted to go through and have you guys actually hear me and how I would respond to some of these questions. I remember some of my actual student responses, like my about me. I remember it because of how hard I practiced it. But some of these, I would just give pearls and stuff. But if you guys wanted me to actually answer it as an example of what would be a decent response, prompt me in the chat, and I'm happy to just fly off the handle with a potential response for you. These questions that I have compiled, they are not possibly they'll come out, maybe they'll come out. I really want you to know that these 100%, you're going to see these questions multiple times. Taking the time to have your own personal game plan of how you're going to approach these questions, I want to tell you with absolute certainty that you're going to be very glad that you've done that. Because once you've mastered the structure of how you're going to respond to these set of questions, they won't catch you slipping. You can apply that same formula to every other question that comes up in the same category as these, and you're going to do just fine. I am so confident of this because I have tested this too many times, and it's tried and true. But these are the questions that I really focus on making sure that, like, when I mock with you guys, like, you're delivering it, your nonverbals on these questions are really good, and the content on it, you're comfortable. And just take my word for it. You want these. You want to be ready for these. And of course, it's the godfather of all boring and uncreative questions. I hate this question so much. It's unreal. But it's also because it's challenging for candidates because most of us are incredibly uncomfortable talking about ourselves. And this is where my soapbox number 2 comes in. I want to tell you that through this process, humility can hurt you. Listen to me, my friends. Humility in this process can hurt you. I don't want you going into any interview and thinking that this is trial by combat, right? Like, those of you who watch Game of Thrones, you know that reference. If you don't know what trial by combat is, please Google it, and you're going to be like, she's so dramatic. But literally, some people go into interview and they think it's trial by combat. It's not trial by combat. You can compliment other candidates. You can encourage them. You're going to see other candidates that they're visibly shaken. They're visibly nervous. Let them know, hey, we've gotten this far. It's going to be okay. You got this, right? I find that it's really cool. Like when I reassure other people in that moment, even if we're competing against each other, it actually boosts my confidence because it lets me know, like, hey, I'm not crazy for feeling a way about this. Like, my competitor is shaking up too. I got this, right? Lending them that little bit of confidence gives me a little bit of comfort and confidence too. So it's not trial by combat. Please don't go in like that. However, if you decide that you're going to be humble about your work and all the amazing things and the great candidate that you are, you're going to do yourself a disservice. Because what most of you assume is that The program has read your CV cover to cover, that your program has read your letter of intent from sentence number 1 to last sentence. I want to tell you like a really bad truth here. That's not always the case. It's possible that they only read your first paragraph and were hooked and they offered the interview, right? So there's still things in that paragraph too, that project you work on, that award you received. Most of us, our awards and recognition section on our CV is at the end of the CV. It's like on the last page of the CV, right? You have got to go in there prepared to stand next to everything you have done and say it with your chest. Please practice this, because if you don't, that humility is going to hurt you. Do not be humble through this. There's a difference between being cocky and being very matter of fact about what you have done, right? The way to answer, tell me about yourself, and the way I coach all of my co-residents to do it is to separate it into 3 quadrants. There's a bonus quadrant, but everybody's not always comfortable with that side of it. And we'll talk about that in a second. But the 3 things that you're about me, absolutely, I think you should break up into 3 quadrants, should include are number 1, the present. Where are you right now? Let's start with where we are and outline that briefly and really well so they get a sense of what's going on for you right now. And then next, we need to step back in time. We need to go back. We need to tell them, how did we get here? We need to take them through the journey of you and how you got here. For many of you, this is how your letter of intent began. It talked about a pharmacy journey that got kicked off because someone in your family got hurt because of a medication error. For some of you, it kicked off with a mentorship, a shadowing day that led to a passion because you wanted to be a part of patients' health journey. And you've maintained that passion all throughout all these years. Residency is the next logical step through that. Take them through that journey. Take them through pharmacy school, what you've accomplished, all of the great things you've done, right? Results, relationship, and outcome. It starts with this right here about me, right? And then after you've talked about the past encompasses education, awards and recognition, qualities and qualifications that you picked up along the way. We talk about the future. The 3rd quadrant, we take them into the future. You clearly say it. My goals, my 1 to 3 year goals include, and residency training is an integral part of that goal because I know that it will do X, Y, and Z for me. These 3 parts, if you nail these 3 parts, you would have put your about me down. You would have taken care of it. The bonus, and where I think is a great differentiator for about me, is when you get into using sentences like, I am passionate about, I am driven to, for my free time, I do this. My dream is to one day do this. A fun fact about me is this. You talk about non-pharmacy related things because up to this point, you've talked about all pharmacy stuff. I think it's really cool when you start taking your interviewer into non-pharmacy things about you. I am a plant mom. I am a cat mom. I'm a dog mom. I'm a lizard mom. I don't know. People are moms to a lot of different things these days, right? I am an activist of this. I am an advocate for that. On my free time, I volunteer at hospice facilities and XY. They have got to know who you are outside of pharmacy. I say this all the time, and I think people are tired of hearing me say it, but pharmacy is what I do. It is not who I am. So when I am asked about me, it isn't just about my professional accolades and my professional accomplishment. It is also about the journey of me as a person and how that person is also wrapped up and shows up as this amazing pharmacist and amazing educator that I know I am. But to give your about me and not talk about qualities and skills and your passion and things you do in your free time, I think it does this question a disservice, because you could form a personal relationship with someone in that interview by saying something like, I'm a dog mom, or I am deathly afraid of large bodily of water. I just go to the pool to sit there, but I will never get in, right? Like, that was actually my fun fact, right? It was either that or I don't know how to drive anything with wheels besides a car. I don't know how to ride a bike. I don't know how to skate. I don't know how to. And they will always find that funny. Like, you don't know how to ride a bike? Really? What? How? Right? Then we are having a conversation about something completely unpharmacy related. And I know that I've created a bond. So think about that. Here, I'm going to give you guys my about me. I don't know if I should do it my about me today or I should do it my about me like from when I was applying, because that's what would be most relevant to give you like a frame of reference of like how I structured my about me. But I kind of went into it and said, so my name is Selimatsu Traore Ualaka. I am a final year student pharmacist at the University of Maryland Eastern Shore School of Pharmacy. It is a 3-year concentrated college of pharmacy program. I am presently completing a clinical track rotation at Georgetown University Hospital, where I am in a surgical ICU. This experience so far has been transformative for my patient assessment skills and the way I do chart reviews and my understanding of how patients can transform from going into surgery and after they come. So that adaptability factor has been amazing, and learning how to adjust my therapeutic plans. My journey in pharmacy began because I am a chronic kidney disease survivor. I met a pharmacist who engaged with me and actually taught me about chronic kidney disease, which completely changed the trajectory of my life and how I stand up to this illness that has transformed my life and the life of everyone else that I am with. I find pharmacy to be a unique thing that has saved my life, and I feel like I am in it because I want to pay that forward. I worked as a pharmacy technician for 6 years before applying to pharmacy school. So I am a non traditional pharmacy student in that sense, because I had extensive pharmacy experience before going to pharmacy school. I ascended to the role of lead pharmacy technician and was integral as part of a work group and committee in creating a satellite pharmacy where I worked. And so I have a little bit of understanding of pharmacy administration and regulations as well. As a pharmacy student, I stepped up for various leadership roles. Most notably, I was president of the APHA ASP chapter of my school. And later, I ran and was elected as Region 2 delegate for APHA ASP. This regional position instantly made me one of 32 most influential student pharmacists in the country, allowing me voting privileges in APHA House of Delegate. This experience allowed me to really hone my communication skills, both written and verbal, but also my collaboration skills, because I was responsible for managing 19 various chapters in the Northeastern region and helping them through the policy process and submitting policies for MRM. As a student pharmacist, I'm definitely a leader among my peers. I have enjoyed a lot of local recognitions as well as national recognitions for many of those projects, delivering my school its first regional recognition for Operation Heart. My goal in 1 to 3 years is to specialize as an ICU pharmacist. I really love the new energy that's around emergency medicine presently, and I hope to be on the forefront of a lot of the innovation that's going to take place in that space in the next 3 to 5 years. A PGY2 is definitely on the horizon, but my goal for a PGY1 is making sure that I have sound, fundamental clinical experience and knowledge, and focusing on exposing myself to a variety of things to make sure that if I do decide to specialize, I know that it's definitely in the right area. Um, I'm passionate about patient care. I'm passionate about health equity. And a fun fact about me is that I cannot swim. I love going to the beach and the pool, but it's just to sit there and read. I will never get into it. Thank you. All right. So that was my about me. I don't know why I still remember that well, but I do. Um, it's just, you have to give global. You have to give them what you've done. You have to talk about you. You have to say what you've done. You can't be afraid to talk about yourself. Before I move on from this, questions at all, comments, anything? Thank you, April. Thank you. Questions, but you just, if you break it up into those quadrants, it allows you to keep track of like, what all did I want to share in this area? What all did I want to share in this area? So on and so forth. Why are you interested in residency? Please go back to your letter of intent. That's the biggest advice I have about this question. You have to make sure that what you say in the interview isn't contradictory to what you said in the letter. They should at least be kind of close, right? And that's another tip. Before every interview, read your letter of intent. Refresh your mind. What did I tell them in my letter? Refresh your mind. What were the qualities? What were the strengths I put in my letter? So that way you're going right into the interview prepared to reiterate and reaffirm those things. You don't want new things because programs get anxious. Okay, well, in the letter, these were the things that they said. And today on the interview, these are the things that they said. So that's two versions of the same person. When they match here, are we going to get a different version? And that makes us very nervous during selection committee meetings. Like, we love authenticity, we love people who show up in their truest forms, because we just want to know that who comes here in June, July is definitely who we've seen on paper as well. But why residency? You have to be able to clearly say, and whatever answer is, please remember to include patient care. Patient care. Nobody is going through all this headache and all the drama that is residency training because they just want to be the best. Why do you want to be the best? When we think about it, ultimately, you want to be the best because you want to advance community health. You want to make people healthier. You want to contribute to advancing science, to advancing community health, and advancing patient health. But you want to be able to clearly answer this question with zero ambiguity as to why you're taking this step. Please take the time. The next one is, why this program? They're going to be keenly interested in your ability to articulate this. In most of everybody's letter of intent, they talk about speaking with current resident. And they said that they spoke to such and such resident, and that resident has such and such to say. That's great. That's one great one. I usually think that you want to tell a program at least 2 or 3 things about why you're choosing them. Reputation is great, right? What you've heard about them, what their residents are saying, what a mentor told you about them, all great. The next thing is, programs love to know that the word is out about them, about the caliber of people that graduate from this program and what those people go on to do, right? If this program is really challenging, if they really push you, they want to know that you have an understanding about that structure and that you feel like it's a fit for you. And what I mean by this is, if a place has 3 ICUs and one of them is a NICU, burn ICU, medical ICU, and you're interested in acute care, you have got to talk about that. You got to plug that. You got to talk about the fact that this is a level 1 trauma center with multiple ICUs, and I want to become an acute care pharmacist. I think that this is a great place to kickstart that training, because I'll have an opportunity to be exposed to so many different areas of acute care. You're interested in AM care. How many AM care clinics are there? How many outpatient programs are there? How many community programs are there? You want to let them know that you've done your research on them in that regard, and you talk about that. You're interested in cardiovascular. What are the strokes program? What are the anticoagulation program? What are the cardiorenal metabolic syndrome programs that they have? Maybe this is a place that specializes in general community health. You want to tell them specifically things that are part of their DNA and their identity. Highlighting that here is very important. And this is another place that if they have a magnet designation in stroke as an excellence center for stroke, an excellence center for transplant, and you're interested in transplant, these are all things you want to talk about as to why this place. It cannot just be because you're from the area and all that. That's icing on the cake. The core, because they do love locals. Programs love to know that they're training one of their own, because guess what? They know that after you graduate, there's a possibility that they could keep you on, right? That's the benefit of being like a hometown candidate, because they're like, oh, this could be a direct hire after residency. But the candidate that comes in that knows who they are and what they do there, and how that is a match for what you are looking for as a candidate, you're going to beat out the hometown candidate. You're going to beat out the hometown candidate. But this is an important question that's going to come up. A time you worked in a team that was inefficient, a team that was not meeting deadline, a team that where there was conflict. This is a situational based question. This is the STAR method. Make sure you outline the situation. If you can describe clearly the situation again and focusing on what action you took, right? Because if the situation was like the team was not communicating effectively and you were concerned that you guys were going to miss a deadline, did you try to resolve it within a team, or did you escalate it to an advisor and got a conversation mediated so that you can get this project back on track where everyone knew what their own individual pieces were? Which, by the way, let me tell you, will stand out in an interview. Like, to say that you had the confidence to be able to escalate a situation that's going on in a group when communicating in the group has failed. You were the one person with the courage to say, you know what, it's time to bring in reinforcement and go to an advisor to mediate a conversation, because at this point, my grade is on the line. That stands out. That's leadership quality. That is get it done by any means necessary qualities, and they'll like that. But the reason why this is ... it's because there's so many variations of this question. But usually this is about leadership quality. This goes into that leadership category, but also trying to see how you function within a team. How do you stay organized and manage stress? The reason why I put this how question in here is because many candidates have no idea how to answer how questions. I want to caution you against this. If you are interviewing and you hear the word how, please immediately in your mind, you need to just realign your mind to understand that they are going to be listening for you to outline things, give a list, describe something, right? How do you manage stress? Well, there are some practical things I do to manage stress, and there are other things I do like self-care, and other safe coping mechanisms that I employ to manage stress. For example, I keep a clear calendar for my personal activities as well as my professional activities. And then I have colors to kind of let me know that. Every Sunday, I do a review of my calendar to look at what the upcoming week is like for me. Another way I manage my stress is by making sure that I set soft deadlines for myself. This always allows me to know that I can finish and complete tasks well in advance before they are due. You got to describe. Like, they are asking, how do you do it? Or how do you whatever? Do not say, I'm not easily affected by stress. I just cope. Or I hang out with like my friends, or I go to the... We need structured things about how we get organized and how we stay organized, right? So how questions are important because it's just a matter of making sure that you don't just superficially do it, but you're descriptive with them. Is there? Yes, there's a question. Um, can I say a person from a healthcare professional outside of pharmacy recommends them as a great teaching facility, or is a better if a person... Okay, excellent question, April. It doesn't matter where your source is. It doesn't matter. Reputation is reputation. And so somebody, wherever you heard it, somebody says, oh, that's an academic medical center. They are a great place to train because there's all this that goes on there. They're advanced in robotics. They're advanced in this. They're advanced in technology. That's something a program would love to hear, that the word out there about them is that they are a great place for up and coming talent to train and get the skills necessary so they can move on to be the innovators that they can be. That's a great question. Thank you. What has been your favorite rotation so far and why? A lot of students kind of go left with this one. Please, I'm just going to say this here and now. Your favorite rotation is the rotation where you had an opportunity to exercise and experience the responsibility of patient care. That is going to be the best response to this question, right? For some people, their favorite rotation is because they'll straight up say in an interview because he was virtual, and I'm like, please never say that. Never say that. Never. Your favorite rotation is never the rotation that you were virtual or the rotation where um it was the least amount of work or you didn't have to present or you didn't. No, that's not your favorite rotation. Your favorite rotation is the rotation that gave you an opportunity to grow. It pushed you out of your comfort zone. It made you realize the responsibility and the burden of patient care, and you got a sense, a taste of that responsibility. Your favorite rotation is the rotation where you were able to make an impactful intervention, and you got that feeling, that bug, where you realize that even at a student level, you have the capability to make an impact on a patient's outcome. And that feeling was intoxicating, right? So you want more training so that you can have more and more contributions of that caliber. Think critically about this and put forth an answer that encompasses something like that. Another variation of this that they love asking is about your favorite precepting style, or what type of precepting style do you thrive under. I want to encourage you to think about that really well, and provide a response, because there's no wrong answer, but you have to be able to describe it, and please attach a story, right? For example, during my ambulatory care rotation, my preceptor communicated really, really well. I had a calendar in advance where I knew exactly what our weekly activities would be. I had a calendar in advance that told me what topics I would be discussing, when things were due. This really helped my learning style because it was structured and organized. So, that effective communication in precepting is definitely one I thrive under. The second thing is a precepting style that is going to reward good performance with increased autonomy. This is a really good thing. If you're a person who does medrecs well, and what you need from that standpoint is to just for the preceptor to back off and let you do what you already know how to do, and you just bring it to them for them to double check your work. If you thrive under those types of conditions, there's nothing wrong with saying that. I think it's important for interviewers to know that you're not afraid of the responsibility of increased autonomy, especially after you've proven that you can function effectively in certain capacities. You love it when preceptors kind of give you that space and allow you room to function in those capacities alone. There's nothing wrong with that. I think sometimes candidates get nervous to talk about their desires for increased autonomy. There's nothing wrong with that. But think about that precepting style and learning styles that you thrive under. Well, I can tell you majority of the most common answer is going to be communication. A lot of people will tell you that preceptors that communicate effectively, they love it. Preceptors that give feedback in real time, effective feedback in real time, so that you're able to make those changes as you go along in real time. Some learners respond really positively to that as well. So don't be afraid to articulate that if that's also like a learning style that you thrive under. Where do you see yourself in X amount of years? They may explicitly ask this, they may not, but you cannot interview from beginning to end and never talk about your goals. This is where that future component of your about me is so important, because if the interviewer has neglected to ask what your goals are, you have fulfilled the responsibility of making sure that you've clearly articulated what your goals are. You don't want to leave that up to chance. You want to make sure that there's clear understanding of what your goals are. So whether they ask you this explicitly or not, find a way to encompass it in there as a goal for yourself. I cannot say this enough. Practice, practice, practice. Um, I'm going to be holding a lot more. I'm not a lot more. You know what I mean? There's 4 more of these lives coming. The next one, don't quote me, I believe is on clinical challenge. I believe is on clinical challenge. And then I have a panel of past candidates that I've worked with that I thought were some phenomenal interviewers. Some of them are PGY2 nows, have interviewed candidates since then. They will have insights that they can also offer you. Please attend that panel discussion. But practicing is your best weapon. Even if you don't know what the clinical challenge is going to be, practicing and reviewing different chapters, reviewing what the guideline updates are, it still is going to make you very, very, very prepared for whatever it is that they come at you with. But please don't underestimate, like, you won't be able to wing this. They designed these interviews specifically so that the candidates that are prepared can emerge very easily from the crowd from those who didn't. So I just want to make sure that we are clear on the fact that practice is everything. Please, please support this channel. Today, liking this live, subscribing to this channel if you haven't already, is really, really an amazing, amazing thing that you can do to help me build this channel and help me grow this channel and make this live today and any other video on this channel discoverable. I really appreciate your presence here, and I just want to use the rest of our time, 15 minutes or so, to entertain any questions that you guys may have for me, about what we talked about today, or in general, because if we're going to get into it in detail, I can tell you that as well, that there's more. Oh, I missed the question. Is natural background okay, or should I have one set up? So backgrounds for me, and the recommendation is the less distraction, the better. Don't have a background. Sometimes people are interviewing on CNN. You can see their bookshelf. You can see like the books that they have on it. Don't do that, because it draws attention to something other than you. You want a background that is dull, for a lack of better word. You want them focused on what you are saying. You want them focused on what's coming out of your mouth, and that only. And so sitting or creating a background that could be distracting or draw their attention to something else may be a disservice to you. I'm glad I'm screening the comment section again to just make sure. Any other question? Before we conclude, my email is open, and you guys know I do my very best to respond to emails as quickly as I can. And so email me. I'm trying to make sure that email is correct. Email me what you need. Email me what you need, because I promise that I'm not going to waste your time. Like, I'm not going to waste you guys' time if I can't help. Right? Like, if I cannot help, I will tell you right away, hey, I can't help, or I'm unable to help. But if I can help, I will help and try to do that as quickly as I possibly can, because I know that time is probably the last thing you guys have. You're balancing preparing for interviews while you're also going on rotation and making sure that you're still performing well there. The stress of that is something that I understand, and can completely understand that you're dealing with a lot. So communicate with me. Let me know how I can help you. I have a tool, like a one sheet cheat sheet about results, relationship, and outcome. And I'm going to create like a free download link for that. Pay attention to the socials. As soon as I have the landing page set up for that, you'll be able to download that one pager. And what I've done is kind of create a table for like result. This is an example question, and this is how you go about answering it, so that you have a frame of reference of how you can help with preparing for that. If nothing else, okay, thanks. I appreciate it. Thank you guys. Thank you guys for the hour and a half on a Saturday afternoon spent with me. It's encouraging because I'm in it to help one person. So it doesn't matter how many people turn up. I in my head, I just want to help one person accomplish a goal. And so I'm thrilled that you all could be here and that you found this valuable. I will announce the date for the next one as soon as I can before the end of this weekend. I will announce the date for the clinical challenge so that you at least have those pearls and the resources I have for that to help you prepare. I hope the weekend is amazing and keep going. Don't give up. Bye, everybody.